will be analyzed and the care will be tailored. Treatment plans will be given by the artificial intelligence, considering individual variations as well as the responses that we are going to upload the data of each patient vital signs or any basic plans that we are uploading the data. It gives you the treatment plans according to the individual variations as well as the responses. Then drug discovery. Drug discovery, artificial intelligence accelerates drug discovery by analyzing vast data sets, predicting potential drug candidates, and identifying the target molecules, streamlining the research and the development process. When we are talking about the drug discovery, so then it is mostly based upon the research. So unless you do any trials, clinical trials on the drug, we cannot prescribe to the patients. Now, in the evidence-based nursing or evidence-based medicine, there are many drugs that we are having in the recent times according to the disease condition. When we are talking about any kind of any field, then see, if any painkiller also, now we are giving antidepressant drug. So that is because of the systematic review as well as the evidence-based practice. It is found that antidepressant drugs are very effective in the painkiller. So then the doctors prescribe the antidepressant drug to control the pain. So these are the, so that this is because side, because of the clinical trials, it is with all other collaboration, medicine as well as the pharmaceutical company and the biochemical medicine and the molecular medicine, everything is come into practice. So then we are finding out the drug discovery also to implement in the healthcare delivery. Then the next one is sufficient needs it is in the, so that we can able to forecast what all the outbreaks can happen in future. So then patient admissions as well as how to prevent the potential complications, enabling proactive healthcare management can be undertaken in the future. So this is based upon the artificial intelligence of predictive analytics. Next. So then next one is the remote patient monitoring. This is the real-time insight it creates for the individuals as well as healthcare people as well as for the patients, and early detection of any potential health issues can be monitored by remote patient monitoring devices. Then the next one is the natural language processing that allows artificial intelligence system to understand and enhance the data extraction from the clinical notes that is based upon the human language and improve the communication between the healthcare professionals. So whatever the clinical notes that we are keeping in the patient's file, it can be uploaded in the SRS. So then we can be able to translate into the human language, so then it can be helpful for the healthcare professionals to come to the conclusion of the diagnosis and to take the prompt treatment also. So then the next one is the robotic surgery. Robotic surgery enhances the precision and allowing for the minimally invasive procedure with an improved outcome. So then there are many hospitals, the robotic surgery it is practicing in abroad as well as in India. But in India it is very less practice. But then in the metropolitan cities, some of the hospitals we can able to see robotic surgery where we can prevent many complications. So then it is less practice in India, but whereas in abroad, robotic surgery, it is frequently used. Then fraud detection as well as the security. As a healthcare industry, because we are having a lots of data in the education, in the administration as well as in the clinical practice. So then this data should be very confidentiality so that we cannot share to anybody. So then we should have our own management system should have a cyber security by detecting any potential fraud, securing patient data and maintaining the integrity of electronic health records. So then we have to maintain some electronic health records to prevent the fraud, to keep confidentiality. So then the next one is the genomic analysis in the healthcare. So then we should have a genomic data set so that it can aid to identify the genetic predisposition, the potential diseases, and informing personalized treatment strategies also it is supposed to have in the healthcare industry in the artificial. This can be done only through the artificial intelligence. Next. So then this is one of the example I have given here, the application of artificial intelligence in accuracy in the treatment of cirrhosis of the liver. You can see that in the middle there is a patient, it is requiring the treatment, is diagnosed with the liver problem. So then you can see that the patient can sit at home only, he can get a virtual assistance through the artificial intelligence. So maybe in terms of telehealth, we can have access to virtual assistance, we can get it, so that we can approach which hospital will treat me, so that we can select a hospital and go to the hospital. So then the accuracy in the diagnosis by using of medical imaging devices, that is diagnostic test, the patient will undergo. So then the accuracy of the data diagnostic set also will be given by the latest technology of nuclear imaging, all those things. So it is all based upon the artificial intelligence. Then the next one is the adjunct therapy. Adjunct therapy may be it is joined with the medical treatment as well as maybe surgical treatment as well as whatever the patient is taking. So that is an adjunct therapy the patient will be planned for through the help of artificial intelligence. So then we can assess the patient for any risk assessment as well as the treatment and whatever the prognostic evaluation can be determined by the artificial intelligence. So then the patient will be giving treatment that will be tailored based according to the disease. We are giving the treatment for the patient. Then the patient maybe had to go for maybe any surgery treatment also. Then post-operative rehabilitation should be monitored or generated through the artificial intelligence. This is one kind of the cycle the patient suffering from liver disease. This is with the help of artificial intelligence. Now also it is there in the in our clinical practice, but then we don't understand this is because of artificial intelligence. We go for the nuclear medicine diagnostic test, but then we don't understand this is all based upon the artificial intelligence. So then when we are going for the diagnostic test of any kind of imaging, the data is prescribed already in the monitor itself. So then it can be extracted afterwards also. So these data should be procured through the artificial intelligence, through the safety of the patients, and we cannot lead to any other healthcare industry or any other. So that is what we should have as an institution. We should have a cyber security, and we have to procure our data, and we have to maintain the confidentiality of the data in the education side as well as wherever the scopes of nursing, we have to maintain all the data. So then we are practicing the paper pencil method only. but somewhere we are having electronic record also. So then when you are writing some nursing notes, it is when we are entering in our system, so then it is already, it comes to the artificial intelligence. In the education side, you can, there are various artificial intelligence are there, like ChatGPT. You might be knowing about ChatGPT. ChatGPT, any kind of disease, if you want to type it, you have to give the correct probe you have to give. So then according to that, it will give immediately the answer what you want. Suppose now if you are typing, it is ChatGPT is free. So then at any amount of information you can get it. So that if you want to do any project or anything, research, then you type it, this particular title, I want it, the research analysis or maybe research protocol, it will give you immediately as it is. And some, but only thing you should know how to probe the artificial intelligence. So how you, but you should be intelligent enough the answer to get from the artificial intelligence, though, so that you should have a correct question to ask to the artificial intelligence. There are various kinds of artificial intelligence in the system, it is there. So then in the educational system, you can able to, even if you want to prepare any PPT, if you are asking ChatGPT, it will prepare an PPT. If any kind of image, if you are asking ChatGPT, it will give you. You don't have to, so that we are not, we should stimulate our brain to work what kind of question you're supposed to ask to the artificial intelligence. So then it will give you intelligent answer to you. Okay, next. 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 So then overview of artificial intelligence in the healthcare. As I said, the diagnostic test, we can be able to do it so that it will, the early diagnosis can be done to take the prompt treatment. Next. Next. So then application to healthcare. So then the treatment planning also can be done. Suppose now, if you are having a diabetes mellitus with a RBS this much amount, you just ask the ChatGPT, it will give you the treatment plan also. This is what your treatment plan, this is what diet you are supposed to take it. It will give you the correct answer. So then the treatment also can be done based upon the artificial intelligence that is incorporated inside the system. But in nursing, that we are not having the system, it can give you the treatment because we are still learning only. We are having the digital thermometer, digital blood pressure monitor, everything we are having. But then how to put it in the system, in the deep learning where it give you prescribed the treatment, it is not there in nursing. Maybe in the recent times, because the research and development it is going very fast. So then it will give you immediately, or maybe in another 10 years, maybe the nursing also the artificial intelligence will take over. So then there is a fear of maybe there will be a maybe a the manhandle work may be reduced because the technology will take over the whatever the care that we are doing in the clinical area. But then there is no emotions. Even the artificial intelligence they are creating with the empathy as well as the sympathy. It can talk to you with the empathetical manner also. This is also, it is now recent research is saying that the artificial intelligence with the empathetic as well as the sympathetic talk, they can be able to laugh with you, they can be able to even angry with you. So this is what it is. It is very growing fast now, the technology. Maybe in another 10 years, we don't know where we are going to be. Okay. So next. So then, as I said, drug discovery can be done only through the predictive model. So then there are various drugs. So they are testing on the animal, then we are testing on the trials on the human. First, whatever the drug that we are studying on the animal. So then that is animal research also is going on the side by, and whereas there are many drugs are testing on various disease condition, it is going on in other side. But when we are opening some of the website like database, WHO, or maybe Cochrane database, PubMed, there are various research studies going on in the clinical trials, even in the nursing. But then we are not aware of it. So we should be read lots of research articles, and we have to understand how this artificial intelligence is going to apply in the healthcare industry. Next. So then robotic surgery, and where we are placed, robotic surgery is taking place. We are having our robotic surgery in endoscopic area. So then we have completed almost 4 surgeries by robot. It is successful also, 100%. Still we are developing in our own institute, in the education side also various research that we are conducting now in the robotic surgery, not robotic nursing. We are developing an electronic nursing record through the research PhD scholar that we are doing it. So then it may come up in another 3 years, so that you can see that various kinds of, not only in our institute, there are various institutes taking part of robotic nursing as well as the robotic surgery, telehealth. There are telehealth is various telehealth we are having in our country, telemental health, telehealth, there are e-health, there are various kinds of health. It is introduced by our government of India also. It is going to take place very fast. So then we should know that how to apply this artificial intelligence as we are a human being. Next. Next, please. Next, madam. A task also can be done through the artificial intelligence, like when the patient comes to admission in the OPD, so when the doctor makes the health record for admission, so then whatever the data we are entering in the system, it will come to even from the starting of the patient in the hospital till the exit, the records will be maintained through the e-record. So then wherever the patient goes, the records are maintaining. So then only thing we have to put it in our system. Then till the billing also can be done by the artificial intelligence. No human error will be there, because sometimes we may miss some of the billing also, but whereas artificial intelligence doesn't make any mistake. Then record keeping also, wherever we are entering, as the record also will be, the data also will be generated for the record keeping of each patient, so that then we are having our own ERP system. So then that will be procured in our own hospital by the management. So then this e-record will be maintained very confidentiality. So in various administrative tasks, artificial intelligence is required. In the education side, we are, as I said, ChatGPT we are using. Just only, it is one of the academic ChatGPT, artificial intelligence. There are various ChatGPTs, various types of artificial intelligence are there. So then you can use it, even artificial intelligence itself, it is one of the website, it gives you the prompt answer. So then in the academic, we are using ChatGPT, that is in the education side. Then that can be incorporated in your own, wherever you are working, in your daily work also, drafting a letter. If you are just putting the word, it will give you the letters. Even the students in the education, you can use it. So then we are asking our students, your PG students, as well as the PhD scholars, to use the ChatGPT so that it gives you immediate answer. So then you can be able to finish off your work at the earliest. So in the administrative task also we can use it, and the education side also you can use it. Next. So as we said in the previous, the diagnostic test also it can be used. Next. 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 I think the whole slide is coming, I think. No. Next. So methodology. So methodology based upon the research methodology, data collection methods. So you can develop your own, even Google form questionnaire, you can be able to form it, and you can upload it in the artificial intelligence. So then you can be able to do the data collection as a PhD scholar by artificial intelligence itself, so that your master sheet is prepared in other way. And at the end of your data collection, so then your master sheet also it is ready. So then the bias is minimized. Then systematic review of academic literature also. Systematic review of academic literature means, suppose now if you are doing a study, so then you will put the mesh terms, that is incorporated in the PubMed itself, as well as the national, international library academy also is having the mesh terms. So then if you are asking mesh terms, maybe the patients can be used in a different terminology in various studies. Whereas systematic reviews, only it is composed of only randomized controlled trials. So then you will get the mesh terms, very hi-fi database. The real terms you will get it in the systematic review. So then it will give you the studies also. So then these many studies are required in my literature. So this literature will be added into your review of literature. So you can able to identify how many literature you have got in PubMed, and how many literature you have got in Scopus, how many literature you have got it in Cochrane Review, and you can, there are various databases there, understand? So even Google Scholar you will get it. Then Medno, there are many database. You can able to upload the mesh terms, and you can understand how many literature you are going to add in your review of literature. That is what it is, a systematic review. So then again, if you are adding any intervention, the intervention also will be giving you various kinds of terminology. So that also can be added, which is essential for to inclusion of your study. So systematic review is the various kinds of studies you are taking and which study is fitting for your study, that is you are going to take in your academic review of literature. So even WHO is having various database it is there, so then you can be able to upload it. So then you can be able to develop a research methodology based upon the systematic review. And the data collection methods also you can able, your own you can able to develop. Understand? You don't need anything, because we are already operating various latest kind of technology, computers as well as the mobiles. You can develop your own Google form questionnaire and you can upload it in the artificial intelligence. So then everything is very easy. You don't have to go for paper and pencil. Okay. Next. Next. So then you are going to analyze in the systematic review based upon your data. So that is, then you can be able to apply whatever the research statistics that you are going to apply. Now in the data analysis also there are various kinds of analytical tests has come, okay, parametric and non-parametric. But then in the clinical trials, various the questionnaire, if it is in categorical, then we are using non-parametric. So then the latest test based upon even deep learning, if you are applying your data, it will give you the analytical part of your all the statistical analysis it will give, and even the interpretation, some of the database is giving based upon your data what you are. But whereas there is no security, it comes into the public domain. So then you are having a problem where you are using. Madam, can you able to see my slide? Hello? Hello? Hello?
Yes, ma'am. Hello.
Yeah, I could not see my screen. Should I share from here?
Unmute करना मैम.
Should I share from here, madam?
Yes, ma'am. Yes, ma'am.
I'll try and see. Can you able to see, madam? Can you able to see?
Yes, ma'am. Yes, ma'am. We are able to see.
Okay, okay, okay.
The methodology slide is.
Yeah, methodology. So then analysis in the larger scale, through the public survey, there are many surveys also you can able to create through the artificial intelligence. That is example that I have given Pew Research Center and the Eurobarometer. Then the other data collection methods also, there are examination of media reports as well as public discourse. Then you are having your own policy, your own privacy when you are securing the data. So then you should always keep your data should be very secured. So then you cannot share it in the public domain. There that we are lacking our privacy. Understand? So then the review of policy documents and the industry reports, that is our institution supposed to secure our data. Otherwise, we cannot control our data to be secure. Because even whatever the research you are doing in the PhD scholar, we are putting it into Sodh Ganga. Sodh Ganga, it's the public domain. It is managed by Government of India. So then you are projecting your data, as well as suppose now if you are doing any trial, you are registering with the clinical trial in the CTRI, that itself Government of India. So then your data comes to the WHO. So then if you want to lock it, you can have your personal lock, you can have it, and you have to, through the payment, you can be able to access some of the data. Otherwise, it is public domain, really anybody can use it, your own property or your own patent. Understand? There we are lacking our system. Then the studies, whatever it is, the time frame, the past 5 years if you are doing, there are now various kinds of research technologies taking place very fast. As I said, maybe in another 2030, by 2030, most of the technology will take over because everybody is developing their own kind of SRS so that they can procure the data. So then maybe they may reduce the manpower, so the people may not get job. So then we should know how to operate the technology. So then we should be very able to operate the technology so that we can, along with the technology, we can able to work. Then the geographical scope in global with the focus on developed country where artificial intelligence integration is more advanced. But we are also developed country based upon our in the global scenario. India also is a developing country. So then whenever you are asking for any kind of help from other country, you don't get it in the research because you are already developing country. This is what they say. So then in India also there are various schemes are based upon artificial intelligence, and the integration is more advanced is taking place in government of India itself. So then we should be very intelligent enough to learn the artificial intelligence. Whereas we are having, even the illiterate people are there, but then illiterate people also having a mobile, they are having various kinds of access to the mobiles. So that through the mobile also you are learning some of the artificial intelligence. Many times you can able to learn through your mobile itself. Now people are aware how to overcome all these kinds of technology. So then the perceived benefits of artificial intelligence in the healthcare, as I said, it is improved accuracy in the diagnosis, like medical images gives a high precision. It is perfect accurate in the diagnosis. Then Stanford study, it is one of the research study, it is conducted by Stanford University, and the artificial intelligence performing on par with the dermatologist. They have done one study with the artificial intelligence comparison with the dermatology in detection of the skin cancer detection. But artificial intelligence also equal to diagnose the skin cancer. As well as with the dermatology also having the same. Par means the equal, they can able to diagnose the accuracy of the skin cancer. This is what. Then the next one, the perceived benefits is it is more faster and more efficient in healthcare delivery because it is taking place very fast. Even the younger generation coming for the PhD, they want to do in artificial intelligence. So then artificial intelligence can process very vast amount of data it can able to manage quickly, reducing without any wasting of the time. So the example I have given here, the British Deaconess, the medical center in our states, reduced the patient wait times by 30% by using of artificial intelligence in scheduling of to meet the doctor. Okay, so this is of the one of the study it has been done where we can schedule the patients to visit to the doctor also. So then the next benefit is the treatment plan also, as I said, the one of the examples through the research, IBM Watson Oncology, they have done the research providing personalized cancer treatment and its recommendation. As I am very proud from this university, the Tamil Institute of Higher Education and Research, we are having our own team with a systematic review. They have diagnosed one of the cancer treatment and it has accepted in the worldwide through the systematic review by in our team of research team members in our university. So then the personalized cancer treatment recommendations also can be done by the artificial intelligence. So then advanced drug discovery as well as the development, as I said, the potential automobiles, it's a molecular based artificial intelligence to identify the potential treatment for Ebola virus in just one day so that we can be able to treat the patients very accurately and the patient can be discharged from the hospital with a prompt treatment. Then the privacy and the data security concerns, still we are not that much effective. The 2019 study, one of the surveys showed 75% of the American concerned about artificial intelligence violating their privacy in the healthcare. So there we are using, so then the healthcare data should be, we have to secure properly, and many of the data is misused and it is compromised when we are coming to the security concerns. Then the algorithms, potential for bias in the algorithms, because stealing of algorithms from one person to another, that is also is another potential risk that we are having. Our AI system may perpetuate and exacerbate existing healthcare disparities. Example, the study found racial bias in the widely used algorithm affecting millions of patients. So then we steal the algorithm. When we wanted to develop our own artificial intelligence in our university, then we should have an algorithm. The algorithm will explain to you in what phase and what are the data that we have to develop and we have to upload it. So then here what happens, there is a racial biases widely used and it is affecting the millions of the patients. So then the another risk is lack of human touch in the patient care. But then when the machine is only touching the patients, then there is no human touch, very lack in touching of the patients. The replacing empathetic human interactions. There are artificial, the robot Sophie, it is having the empathetic even the relationship with the patients also. It is used in America. Survey showed 54% of the patients prefer human doctors for the emotional support. So then you can see that the other 46% of the people are using artificial intelligence. So then in only we are going to, most of the people are using almost artificial intelligence. Wherever you are sitting, if you are having pain abdomen, you just type it in your Google Chrome, it will give you immediately, the artificial intelligence will give you the answer. So what treatment you are supposed to take. Then the another risk is job displacement for the healthcare workers. The AI might replace certain medical professions. Example, McKinsey report suggests up to 30% of the nursing staff tasks can be automated through the artificial intelligence. Maybe only 70% only man is required. 30% can be right now. Maybe in another 10 years, we don't know. So then we should be very careful to prompt enough to use the technology. So then there is a case study in artificial intelligence in the medical imaging, the faster diagnosis I said, the 90% in seconds you will get the prompt results. There is an increased accuracy is improving, 95% accuracy in detecting lung cancer in the human radiology department. This is one of the case study. This is another case study in the assisted radiology also. Even the artificial intelligence can make mistakes, especially very rare conditions, but unusual presentation. If you doesn't know how to present the prompt questions, if it is not proper, it can lead you to in a different manner. So then, suppose now whenever we are using our mobile also, you can be able to Google Map we are using to reach to the particular destination where we doesn't know. So then if you doesn't know, if you don't know how to put the destination properly where we supposed to reach, so then it will automatically, it will misdirect us, okay? Instead of if you did some small mistake also, it will misdirect us. So this is one of the artificial intelligence, it is incorporated in the mobile itself. Then 66% of the people trust in the artificial intelligence for the administrative tasks. Then 47% of the people trust in the administrative tasks for the medical diagnosis. Then this is the transparency, the trust artificial intelligence with the human doctor also. You can transparency in the artificial intelligence where we can able to take the decision based upon the diagnostic test that we have performed. Then you can able to track the record and the endorsement by respected medical institutions, then personal experience with the artificial intelligence in the other domains also. There are some demographic differences in the perception. The younger generation, you can able to see 18 to 34 years more likely to trust on the artificial intelligence. Whereas in the healthcare also 62% of the people are depending upon the artificial intelligence. Only older generation 65 above, we cannot able to trust the artificial intelligence. They are less trusting, that is 43% of the people are less trusting in the older generation. So then educational level also it matters in the perception because higher education correlated with a more positive perception in the artificial intelligence. 72% of the postgraduates positively accepted the artificial intelligence and 54% of the people accepted artificial intelligence in the high school education according to the recent studies. Then there are developed countries generally more accepting, 65% of the people are accepting artificial intelligence positively like US. Developing countries, there are mixed perception like India, often influenced by the current healthcare access issues are there still. But still, maybe in another 5 years, we will also will be accepting artificial intelligence. Then trends is now changing. Gradually increasing acceptance, artificial intelligence becomes more commonplace. Growing demand for the artificial intelligence, literacy also going on. Every institution is taking workshop and the conference in the artificial intelligence regarding the patients, how to take care, and the healthcare providers also taking the training in artificial intelligence. In engineering, people are taking some of the workshop for the nursing people also because the artificial intelligence we are having in our own university, the engineering people are orienting us how we have to use artificial intelligence. So then there are many institutions is approaching the technological people also to take the orientation program in our own institute so that we can update and we can accept the artificial intelligence positively. Then there are some factors, there are breakthrough in the artificial discoveries, successful implementation in the hospital. There are negative major data breaches, as I said. Then data can be stolen by anybody unless you have your own secure system. So that is one of the negative impacts can affect the institute. This is given by WHO, the ethics governance of artificial intelligence for the healthcare, the principles set by the WHO in the healthcare. If you secure the following these kind of principles, you can be able to secure your data. Protecting autonomy, promoting human safety and well-being, ensuring transparency, fostering accountability, ensuring equity, and promoting tools that are responsible and sustainable in the industry, in your own industry. So then, if you are taking about the securing future legal and the ethical, there are ethical regulations. We should have a privacy, mitigation of bias should be there, should be transparency and the relevance, and the legal, we should have our own institution policy governance, and the guidelines to secure the data, confidentiality, liability, accuracy, and the decision making people by the management should be prompt enough to secure the data. So this is the some of the legal that I have given. So conclusion: the public perception of artificial intelligence in healthcare is mixed, but generally it is trending positive only. So then benefits are widely recognized, but significant concerns are remaining still, but that will be achieved in another 10 years. Trust is a critical factor in adopting the artificial intelligence. So conclusions with the recommendations: increase public education about artificial intelligence in the healthcare, implement robust is a gold standard, privacy and the security measures to be secured in the institute, ensure transparency in artificial intelligence in the decision-making process, maintain a balance between artificial intelligence, efficiency and the human touch in the patient care. So these are the references that I have used here, and thank you for your attention and the engagement. Thank you very much.
Ma'am, का नहीं?
Yes, ma'am, I have completed now.
Thank you, ma'am.
Yeah, thank you very much, madam, for giving me this opportunity. Thank you so much.
Ji, ma'am. Thank you so much, ma'am, for providing us such an elaborative and integrated knowledge approach of artificial intelligence in healthcare. It was such an innovative experience understanding the various aspects and application of AI in various healthcare modalities. Thank you so much, ma'am. We are
Thank you
highly
very much.
privileged to have your lecture today, and we look forward to have more knowledgeable sessions from you, ma'am. Thank you so much.
Yes, ma'am. Thank you. Thank you very much. Can I leave, ma'am?
Excuse me?
Can I leave now?
You want to leave?
Yes, ma'am. If you want to leave, please you can.
Ma'am, well, if you, it was very precious for us to have your presence, and if you have schedule, you can, ma'am.
Yeah,
Thank you so
thank
much.
you. Thank you very much, ma'am. Thank you.
Okay, ma'am. Thank you.
Thank you.
All right, dear audience, we have another speaker, Mrs. Saurabha. She's currently working as a professor in Shri Swami Bhumanand College of Nursing, Haridwar. She's a master's in nursing with 15 years of experience. Her specialty is obs and gynae. Mrs. Saurabha has been dedicated to her role as a professor in the Department of Obstetrics and Gynecology for more than 15 years, sharing her wealth of knowledge and experience across various esteemed educational institutions in Karnataka. Her research contributions has been featured in the renowned International Journal of Current Science and International Journal of Research Publication and Reviews. Additionally, she has provided valuable mentorship and guidance for research projects to BSc and MSc students. Well, as an esteemed professional, she has been honored to share her insights as a speaker at faculty development programs and webinars, and have actively participated in a diverse array of national and international workshops, webinars, and conferences. Furthermore, her active involvement in staff development programs has allowed her to contribute significantly to the planning, implementation, and evaluation of nursing programs, ensuring the highest standards of education and professional growth. So we welcome Mrs. Saurabha ma'am for her presentation. Her topic for today's international webinar is Advantages and Concerns of Artificial Intelligence. Mrs. Saurabha, we welcome you, ma'am. Ma'am, please unmute yourself. You are not audible.
Thank you, ma'am, for your warm introduction. So,
Thank you,
dear
ma'am.
student,
esteemed speakers and my dear colleagues, thank you for joining us today for this insightful discussion on advantages and concerns of AI in healthcare. So, AI, it's not only a buzzword, but it is a transformative technology that is transforming and revolutionizing the future of medicine. So I hope all are heard of AI or artificial intelligence. So you might have seen an updated version of Google or WhatsApp. So you might have seen the AI overviews and then Meta AI. So we all are using on a daily basis. So what is the functioning of this artificial intelligence? So moving further, I just tell about what is artificial intelligence too. But before that, what is the functioning of this artificial intelligence? I just wanted to tell because many
Excuse
students
me,
have joined.
second, we can't see your screen, ma'am. We can't see the PPT, ma'am.
Just a second, I'm sharing. Am I audible, right?
Yes, you are audible, ma'am, but we can't see the presentation. Yes. Now it is visible, ma'am. Thank you so much.
Okay. Thank you. So as I said, so artificial intelligence is one of the advanced technology. It is not just a buzzword. It's a transformative technology that is reshaping how we diagnose, treat, and care for the patients. So, as I told, what is this artificial intelligence and functioning of artificial intelligence? How does it help the human? So, this artificial intelligence will provide you an insightful information like a human, which is more accurate and faster than any human specialist. So that is what the main functioning, the difference between the human intelligence and the artificial intelligence. So this artificial intelligence, if it is to be defined, it is the simulation of human intelligence by the machines. So where in healthcare, AI using complex algorithms and software to analyze the vast amount of medical data, which is providing insights and which were previously unimaginable. So sometimes what happens, like while providing care to the patients, the human error will be occurring. So that is one of the major concern in providing care to the patient. But how this artificial intelligence is working, so which is more
Actually, the slides are not changing.
more accurate, and then in providing more faster answer to the questions, or it also capable of providing a solution to the problem, which is of more accurate information. So that is what the what benefit we get from the AI usage in healthcare. So, for example, a world where your devices anticipate your needs, healthcare system diagnose diseases with unerring accuracy, and cars drive themselves seamlessly through busy. Just a sec. Excuse me, just a second.
भाई लगवानी है, कहते वैक्सीन लगवानी है। क्यों? बीमारी ना लग जाए हॉस्पिटल में। कब लगवानी है? 4 साल हो गए। 4 साल हो गए। किस साल में? देख गया सब। सबको लिए स्टाफ है, ताकि हॉस्पिटल में बीमारी ना लगे। सारा नियम कुछ घुसा तो नहीं देगी। करनी चाहिए, इसलिए कि आप अपने बीवी बच्चों के पास जाते हो, उनको कोई बीमारी ना लेके दे जाओ वैसे यहाँ से। लगी थी हमें कोरोना की है वो वैक्सीन, ये अलग है।
I request dear audience to be patient. I guess there must be some technical issue, so uh, let us wait for some moments. I guess yes, we can see the slides now.
Sorry for the disturbance. Am I audible now?
Yes, you're audible, ma'am. Now we can
Okay.
see the first slide of introduction, and I request you to keep changing the slides as you continue with your presentation.
Sure. Thank you. So, as I said, the artificial intelligence is a simulation of human intelligence. So, here I give you one example that where the world uses, like where we are using now the advanced technology, where we use the smart watches and then smart phones, where our devices anticipate our needs as well, and then healthcare system where the diagnosis of the disease will be done with the unerring accuracy, and even car drives seamlessly through the busy streets. So nowadays, like I don't know, you might have seen where car also without driver, if we apply some softwares, it will drive seamlessly through the busy streets with the help of artificial intelligence. So this is what the power what the artificial intelligence has. So this is not just a distant future. So this is artificial intelligence at workplace and transforming our reality today. So when it's coming to healthcare, imagine a world where your smartwatch not only tracks your steps, but also alert you for the potential health issues. That is day before they become serious. And then, now potentially any health issues, especially the emergency conditions like heart diseases. So if you get an alarm before the patient collapse, so that is what the power the artificial intelligence has. So nowadays we have the accessibility to these kind of technology in our daily lives, so that helps bringing a transforming and revolutionizing changes in the healthcare. So where AI can diagnose a disease with pinpoint accuracy, even better than a seasoned specialist. So it's a reality where we are living in, where we have to thank to the power of the AI intelligence. So where with the help of artificial intelligence, the imagination meets implementation, and the extraordinary has become the everyday challenges. So before we discuss about some promising benefits and challenges of AI in healthcare, I just want to say the aim of artificial intelligence, which enhances the diagnostic accuracy, personalizing the treatment plans, and improves the workflow efficiency. So yet it comes with certain challenges and the considerations. ethical considerations, it has numerous benefits as well. So next we are going to discuss about the benefits as well as the advantages of AI in healthcare, as well as the risks or the concerns in the integration of AI in healthcare. So this groundbreaking technology is not just a future concept, it's already transforming healthcare practices worldwide. So let's begin with the first advantages. The first advantage of AI in healthcare, that is enhanced diagnostic accuracy. So even the previous speaker had told when she has discussed about the benefits. So it provides you a diagnostic accuracy where AI has a power to analyze the medical images such as X-rays, MRIs, and CT scan with a higher precision. For instance, AI algorithms can also detect the chronic disease conditions at its early stage, which is very important, right? So where if we could able to detect the disease condition in its early stage, we can implement the treatment plans as early as possible, which helps in bringing a improved patient outcomes. So that is one of the advantage of the AI in healthcare. So the first advantage is enhanced diagnostic accuracy. So whatever diagnostic measures we carry out in the hospital, especially the X-rays, MRIs, and CT scan, will be done in a very high precision, and these algorithms can able to detect the early signs of the cancer, not only cancer but also many other potential diseases in its early stage, which might be missed by the human eye. So sometimes some even signs and symptoms of certain diseases will not be identified in its early stage. That can even detected by the usage of artificial intelligence. So this helps in bringing a better, improved patient outcomes, which is solving the diagnostic mysteries with the fewer errors. So one of the advantages that there will be very less errors and high accuracy. So that is what the advantage of AI in healthcare. So for example, presently or currently that we have Google's DeepMind, which is helping in diagnosing the disease condition. Here I given one example of Google DeepMind, that is, it is capable of identifying or diagnosing over 50 eye diseases from the retinal scans with remarkable accuracy. So that is one of the example for the accuracy of diagnosis, how the AI is providing. So next advantage is that the personalized treatment plans. Even so, in the last session, Madam told that personalized treatment plans. That means so hospital, like on a daily basis, there will be like the number of patients we cannot count. So that is like there are many patients are getting into the hospital for outpatient department or inpatient department. When the and even the patients conditions also will be different, patients medical history will be different, and their genetic profile and lifestyle choices, everything is completely different. So under the personalized treatment plans, AI can take into account a medical history and genetic profile, and even lifestyle choices of each patient to create customized treatment plans. So, is it possible by the specialists? So, it is highly impossible to provide a customized treatment plans. So, sometimes certain things will be missed by the human eye. But AI is having that power to take into account a individual patient's medical history, genetic profile, tailored lifestyle choices to customize the treatment plans. So that is one of the unique nature of artificial intelligence, we can say. And even it provides a tailored treatments for individual needs. So what is tailored? That means the tailor's work is what? So he will stitch the cloth according to the body fit of the person who has given the cloth. So same way, this AI also will be tailoring the treatment for the individual needs by identifying the individual needs, by detecting or by doing the assessment, by identifying the patient's medical history, genetic profile, and the lifestyle choices of the each individual. This artificial intelligence will be tailoring the treatment according to the patient needs. And this also has increased effectiveness. This means the treatments can be tailored specifically to the individual's needs and potentially increasing their effectiveness to that treatments. Obviously, like when the treatment is planned according to the patient need, so it is more effective in treating the patient condition. So it is like a lock and the key. I can, this is just an example that it works like a lock and key. So to open the lock, you have to put a perfect key to open the lock. Same way, this personalized treatments. So understanding the individual needs. So we are customizing the treatment plans. That not we, artificial intelligence helps in customizing the treatment plans for the patient. So that is also one of the advantage of artificial intelligence. Next is streamlined workflow. So here streamlined workflow, how the artificial intelligence is working, even not only providing the better care to the patient, but also it has a power in automating administrative tasks. So where by automating the administrative tasks, the artificial intelligence will be used for scheduling the patient's admission and then billing and patient record management. AI intelligence or AI power can even be integrated in the administrative tasks. So especially in the scheduling, billing, and the patient record management, and make the healthcare professionals free up from these administrative tasks, and by this the healthcare professionals can more focus on the patient care. So so that the healthcare workers or the healthcare professionals can give more efficient operations in the hospital and reduce the burnout among the healthcare workers. So if administrative tasks also done by the healthcare professionals and care also provided by the healthcare professionals, then what happens? The most of the time has to be given to complete these administrative tasks. So if AI is integrated in the administrative tasks, what happens? This will do its work like scheduling, billing, and patient record management. Everything will be done faster, and without any error, and it also frees up the healthcare professionals, which helps or which lead to more efficient operations in the hospital, and healthcare professional only can concentrate on the patient care. So that is one of the major advantage for the healthcare professionals by integrating AI into the administrative tasks. So, according to a study, healthcare providers spend nearly 50% of their time on the administrative tasks. So, AI can cut down this time significantly, and then allowing more time for the patient care. So that is what the functioning of AI in the healthcare. So this is what called as streamlined workflow. So by automating the administrative tasks, it helps to frees up the healthcare professionals, saves the time of the healthcare professionals, and make the hospital functioning more efficient, so that the healthcare professional completely they can focus on the patient care. So one of the advantages that when the healthcare professional completely focusing on the patient care, there is the treatment, what we can that cure, the patient get cured by the disease as soon as possible, and then he will be discharged from the hospital. So that is also one of the advantage of artificial intelligence in healthcare. So moving on to the next slide. Proactive health management. So already I have given the example of smartwatch. So smartwatch is one of the AI powered wearable device that where the person wears on a daily basis. Nowadays, like even the children or the college students and even all age group people, we are using the smartwatches that is of AI, that is powered with AI, which helps in monitoring the patient's vital signs in real time, or monitoring the person's vital signs in real time, and give the accurate information about your vital signs, which helps in identifying the potential health issues before they become serious. Isn't it a wonder that the AI is creating in the healthcare? So that is a very impressive function of the artificial intelligence, that the wearable devices like smartwatches will be giving real-time monitoring of the vital signs of the person or the patients. So this devices can alert both the patient as well as the healthcare provider to any potential health issues before they become serious, which is allowing for the proactive health management. So as early as you identify the disease, the better the treatment can be provided and then save the life of the person. So for example, AI devices like the Apple Watch use AI to track heart rate and detect the irregularities, providing real-time health insights. Not only the heart rate, even blood pressure monitoring will be done, and oxygen level will be checked with the help of the smartwatches, or we can say the wearable devices. I hope you understood these advantages. Few more advantages are there. I'm just going to continue with those advantages. This is regarding proactive health management. So next is improved mental health care. So how does this artificial intelligence helps in mental health care? Means, so there are operational interfaces like AI chatbots and the virtual therapists. So these operational interfaces will provide support and counseling to the patients. So this will be making mental health care more accessible to the people. So when there is an absence or any lack of human therapists, these AI chatbots and the virtual therapists will be supporting the mental health patients. So whether all mental health patients are going to the doctors or the psychiatrist, some are searching for the support and counseling at the convenience, at their convenience. So that may be with the help of artificial intelligence chatbots and virtual therapists. So making mental health care more accessible with the help of these interfaces, and these tools can offer immediate assistance. That is when there is, as I told, when the human therapists are not available. So when there are, especially we have faced these problems during the COVID-19. So COVID-19 is a situation where the people cannot come outside, cannot reach out to the doctor. At that time, these AI chatbots and the virtual therapists, these are not human, but still it could able to provide some support and counseling to the patients. So that is what the power the AI chatbots and the virtual therapists, that is how it is functioning for improving the mental health care of the patients. So even at the absence of human therapists, these AI chatbots and virtual therapists will be helping the people. As I given the example of COVID-19, where the people cannot able to come outside and get the help of human therapists or the doctors, even they cannot able to reach out to the doctors, these AI chatbots and the virtual therapists can even be like accessed with the help of even the mobile phones. So that is bridging the gap in human therapist availability. So for example, AI chatbots like Obot and Visor have been found effective in providing mental health support. So as I said, in COVID-19 pandemic, many people had accessed in-person therapy to these AI chatbots. So what is the difference between the standard chatbots and these AI chatbots? Means standard chatbots will give you the responses which is already generated, means which are already programmed, pre-programmed results only will be given through the standard chatbots. But these AI chatbot has like a human responses to human input, where these are trained on the non-scripted conversational responses. The standard chatbots are scripted, and only they will be giving the responses on the basis from which they have programmed. But these, as I told, the AI chatbots will be delivering human-like responses to the human inputs, where these are providing a wide range of non-scripted conversational responses to the human text and voice input. So that is also one of the advantage. That is how we can improve mental health care with the help of these AI chatbots and the virtual therapists. So these works when the human therapists are not available. Correct. So this helps the people when the human therapists are not available or not accessible for getting the counseling or for the psychological support. So this is what the advantage of artificial intelligence in improving the mental health care. So next, moving on to the next slide. Enhanced surgical precision. So madam also had discussed regarding the enhanced surgical precision, where the robotic surgeries correct? AI assisted robotic surgeries can perform the complex operations or complex surgical procedures with a greater precision. So obviously, when the surgeons are performing the operations, there will be some kind of risks or the side effects will be present. So one of the advantage of AI is that it works with a greater accuracy and the minimal invasiveness. So how much the incision to be made, and then how accurately this robotic surgeries are done. So with that, the patient will be benefited. So this can lead to less invasive surgeries, reduced recovery times, and better overall outcome for the patients. So, for example, the Da Vinci surgical system is a commonly used robotic surgery technology that incorporated a AI system. So, artificial intelligence being incorporated in the Da Vinci surgical system, which are commonly used robotic surgery technology, which helps in conducting the surgeries or performing the complex procedures with a greater precision than the human surgeons. So this can lead to less invasive surgeries, reduced recovery times, and better overall outcome of patients. So this is what enhanced surgical precision. So by integrating AI in the surgical system, what happens? This will work with a greater accuracy and with the minimal invasiveness. So, and then it is works in a greater precision than the human surgeons, and it also reduces the recovery time of the patient as minimum incision has been made. Obviously, it also reduces the recovery time for the patient, and better overall outcome of the patient also will be brought. So that is regarding enhanced surgical precision. Next slide. Capacity planning. So when it comes to capacity planning, AI can analyze the historical data and predict the patient admission rates. So in which season or in which month the disease condition rates increases, that can easily identified by integrating AI in the healthcare system. So AI can analyze the historical data and predict the patient admission rates, which helps the hospitals to manage their resources more efficiently. So whenever the admission rates, when there is a chance of increasing admission rates, at that time the hospital, if they get the information early, they can easily manage their resources more efficiently. Like there are some seasons where the admission the hospital admission rate increases, and then there are some seasons where the admission rates decreases, which is that may be the winter, summer, or rainy season, which will be influencing on the health of the person. So based on these seasonal changes, the admission rate also will be changing in the hospital. So this AI, what is the function of this AI? AI will analyze these admission rates, patient admission rates, like when it increases, when it decreases. So that will be identified by the artificial intelligence and helping the hospitals to manage their resources more efficiently. So this can ensure the staff and equipment availability that are enough availability to meet the patient needs. So if you come to know, when the resources have to be managed more efficiently, when the admission rates are more, so you have to recruit more staffs, and then you have to allocate for the number of equipments. So you have to increase the number of equipments in the hospital. So that will be identified by the AI integration in healthcare. So that is regarding capacity planning. So how does it helps for capacity planning? Artificial intelligence will be analyzing the or predicting the patient admission rates in the hospital, and that helps the hospital to manage their resources more efficiently, and this can ensure that there are enough staff and equipment available to meet these patient needs. So we are not just talking about these advantages, but also it has been practiced in the hospital, like NYU Langone Health use AI to predict the patient admissions and optimize resource allocation, improving the efficiency and patient care. So here what we can see is artificial in the capacity planning. So when there is a chance of increase in the admission rates, when the hospitals are not having enough resources to fulfill that requirement, obviously what happens, the healthcare like they will not be efficient, care will be provided to the patient, and the hospital fail in meeting the patient needs. So this should not happen. So this when to make this not to happen, this artificial intelligence will be helping in predicting the patient admission rates, when it can increase and when it can decrease, and how to manage the resources of the hospital. So when the hospital comes to know this, so obviously they can efficiently manage and efficiently allocate the resources for providing more efficient and more improved healthcare. So that is regarding the capacity planning. And the last advantage, what we are going to discuss, is population health management. So this population health management, it means the AI has a power to analyze the large data sets from various populations to identify the health trends. So how the AI also can be identifying the health trends in the society or in the community, that is in the media. So AI models that analyze the social media trends and search engine queries. So when many people, I'll give the example of COVID pandemic itself. So obviously, when the person during the COVID, when the person sees any kind of flu-like symptom, so obviously immediately he go to the search engine in the Google and search for the information. So when this happens, AI model can able to analyze this social media trends and the search engine queries and other public health crises, and that will be leading more effective interventions and improved health outcomes on a larger scale. So this is how the population health management can be done in a more efficient way by analyzing the data from the larger population to identify the health trends and inform the public health strategies. So that is what given the example, like social media trends and the search engine queries. So search engine queries means immediately when we get sick, nowadays like everybody practice that, everybody go to the Google and search for the information first before going to the doctor. That even everybody will, every one of us, we do it when we get sick, right? So these queries, the informations will be collected by the artificial intelligence, and that gives the information to the public health management people, and then that is how one can analyze the large data sets and provide more effective interventions and improved health outcomes on a larger scale. So I hope you all understood that advantages of AI in healthcare. So as I already told, today we are not only going to discuss about the advantages of AI in healthcare, but also the concerns of AI in healthcare. So as I said, AI not only has benefits, but during the integration of artificial intelligence in healthcare, it also comes with some challenges and ethical considerations too. So next we will discuss about the concerns of AI in healthcare. Firstly, we see what is data privacy and security. So as I told it, the AI integration in healthcare not so easy. It comes with many challenges. Among these challenges, one of the challenges is that the data privacy and security. So I have already told that when the AI will collect the information for providing care to the patient, it collects the vast number of data from the patient. So these data are very confidential. So these data should not be misused, or any leak in the security and privacy of the data should not happen. So to protect this patient data, which has been collected to provide a patient care, is one of the major concern of the AI integration. So protecting this data from breaches and misuse, as I told, is a significant concern. Ensuring that the patient data is secure and used responsibly is one of the paramount. So how we can protect these data from breaches and misuse? So nowadays, there are hackers who misuse your data and then who breaches the data. So even this happens in the healthcare as well. So to prevent these breaches and misuses of the data, there are some precautionary measures needed to be taken, where healthcare providers, while implementing this AI in the healthcare, should use robust encryption and cyber security measures to protect the patient from unauthorized access. So what they have to do? They have to use the robust encryption and cyber security measures. So as this artificial intelligence works on the basis of algorithms, data patterns, and the software, this is that while creating this data patterns or the algorithms, so we have to implement the artificial intelligence with the robust encryption and the cyber security measures needed to be taken carefully, so that nobody can access to the patient's data unauthorizedly. So that is one of the major concern in the data privacy and security. So for example, see, these things we are not only discussing, it is already been integrated, but we don't have enough knowledge that this has been already used. So now we have the technology called blockchain technology, which can be integrated with AI to enhance the data security, ensuring patient information which is protected and tamper-proof. So no other person should unauthorizedly access to the patient's data, so that we have the technology called blockchain technology, which can be integrated to enhance the security and ensure the patient information is protected and tamper proof. So that is how we can protect the each patient's data, and that is how we can secure the data of the patients. So that is regarding one of the major concerns of AI integration in healthcare. So as I I'm repeatedly telling you that artificial intelligence is not only comes with the benefits, but also it is comes with many challenges, and the ethical consideration also to be taken into account. So then only we can able to integrate AI in healthcare effectively. So next, move on to the next concern, or next concern of AI integration in healthcare, that is, there is a chance of bias and fairness in the integration of AI in healthcare. So there will be some biases or the mistakes can happen while integrating AI in healthcare. So AI systems are not only as good as the data they are trained on. If the training data is biased, see, AI intelligence is a trained data. So it is not natural one. We, in the name itself, it is there that it is a artificial intelligence. So it is trained or made by the human itself, right? So to help the healthcare professional, especially in the healthcare. But also the artificial intelligence is used in many other areas too. So if the training data is biased, there is a chance that AI system can also be biased, potentially leading to unfair treatment for the patients. Ensuring that AI system are fair and unbiased is very critical. So when the AI intelligence has been integrated in the healthcare, we should train or the data has to be prepared in such a way so that it can meet all the patient needs. So if it is not trained and not prepared, based on the patient needs. So even though the artificial intelligence system can also be biased, potentially leading to the unfair treatment to the patients. So there is a chance that this also can be unfair, and then it also can be biased if it is not trained proper over the data in providing the patient care. So AI system can exhibit bias if they are trained on unrepresentative data sets, which leading to unfair treatment outcomes for certain patient groups. So if they are trained only to treat certain patient groups, then they are effective only for that patient groups, not for the other patient groups. So that is what ensuring diverse and representative training data is critical to mitigate the biases in AI algorithms. So to overcome with this risk or the disadvantage, what we can do, we have to train the AI data sets in a diverse and representative training so that it can treat all the patient groups, not only it to be effective in certain patient groups. So this helps in mitigating the biases in AI algorithms. So next is job displacement. So job displacement is also one of the disadvantage, we can say, or the concern of AI implementation or integration of AI in healthcare. So job displacement. So when the machine starts doing the human work, obviously, what happens? This replace the jobs of the healthcare workers. Isn't it obvious? So it will be more obvious that if the machine starts doing the healthcare workers work or the human work, so that place will be replaced by the machines. As it is, the artificial intelligence is more efficient in doing that, more efficient in providing the patient health care. The automation of certain tasks by AI could lead to job displacement concerns in healthcare sector. So for this, what we have to do, like if it is displacing the place of human or the person in the job area, so it is not that good for human, right? So they have to get the chance to work. So for that, we cannot say it is completely displacing the person's place. We can say that this can be replaced by retraining and redeploying the affected workers. So that is very important. So the workers can be retrained and redeployed on the basis of how to handle this artificial intelligence or the machines. To handle that machines, we need some workers, right? They have to be trained on this, so that that also can be easily handled. So this disadvantage also can be easily handled by retraining and upskilling the affected workers to adapt into the new roles. So that is one of the disadvantage of the AI integration in healthcare. So we cannot say that all the jobs will be displaced. AI also creates some new roles in the healthcare by, that is AI maintenance, AI programming, AI data analysis. So the only thing is needed to be, like the person needed to be trained on the maintenance, programming and analysis of the artificial intelligence. So we cannot say this is this is a disadvantage of artificial intelligence in healthcare. It is just that it creates a new role for the workers in the maintenance, programming and data analysis of the artificial intelligence. How to do it? Then we have to give the training to those workers and upskill them how to use this artificial intelligence in the maintenance, programming and data analysis. So next concern is dependency on technology. So when the machine starts doing all the human work, so obviously we human, what we will do? We stop thinking, or our skill will be like we miss our skills, right? So artificial intelligence could lead to the reduced human oversight and critical thinking. So this critical thinking also will be reduced. So its importance is to maintain a balance and ensure the human healthcare professionals remain actively involved in the patient care. So because the machine is doing all the work, we cannot be subtle. So we have to maintain a balance and ensure that human healthcare professionals remain actively involved in patient care. So AI is a tool to augment, not to replace human judgment. So it is just assisting the human. So you have to understand, I am repeating this, AI is only for assisting the healthcare professional, not to replace the healthcare professionals. So it's like having a highly skilled assistant to support and support and enhance healthcare professionals' decisions. So it makes your work more effective and more easy. So that is how this highly skilled assistant will be helping you and then supporting you in the workplace. So this is also one of the concern of AI integration in healthcare. So next concern is that regulatory and ethical issues. Obviously, it is not a human; it is a machine. So it must comply with various regulations and ethical standards. So these data needed to be data sets on which the AI needed to be trained, ensuring that the AI systems are safe, effective, and used ethically is a significant challenge in the AI integration. So if we have to integrate AI in healthcare, it is also should be trained on the data sets that how, in which situation, what action needed to be taken. So that ethical dilemma related to AI decision making in healthcare must be navigated carefully. So ensuring the transparency and accountability in AI decisions is very crucial in implementing the artificial intelligence or providing care to the patients or providing treatment and diagnostics. So these are some of the concerns of AI in healthcare. That is one more concern is that the last concern or the cost and accessibility. When it comes to cost and accessibility, AI system integration is not so easy. It is very expensive. So that all the healthcare providers cannot able to afford and cannot able to implement or integrate this AI system in the hospitals. So ensuring that AI is accessible to all and does not widen the gap in the healthcare disparities is also one of the crucial concern in implementing the AI systems. So AI implementation in all the hospitals, as I said, they don't have enough resources to implement it in the healthcare. It will take time. So in the implementation of artificial intelligence, all the healthcare providers need to understand that this machine learning or artificial intelligence treatment needed to be accessible to all and doesn't widen the gap in healthcare disparities. And AI can help to lower overall healthcare costs. So how does it reduce the overall healthcare cost? That is by reducing the hospital readmissions and unnecessary procedures. So as I told you at the beginning, so it is giving more accurate information, and when the surgery is being done, treatment to be provided, it is very like there are very less errors in providing the treatment or in identifying the disease condition. So that is how it avoids the hospital readmissions and unnecessary procedures, making healthcare more affordable and accessible to all. So that is what one of the best advantage. That is how one can reduce the cost and accessibility with the help of See, for the implementation, it's very costly, and not all the healthcare providers are having enough resources, adequate resources to implement or integrate it. But once it is integrated or implemented, you have more benefits, like it is reducing the hospital readmissions and unnecessary procedures, especially the patients will get benefited by this, making healthcare more affordable and accessible. So that is what the cost and accessibility. So this is regarding the advantages and the concerns of AI in healthcare. So already I given some examples, like already the artificial intelligence which has been implemented in the healthcare. So these are some of the case studies and examples, like IBM Watson Health, which analyzes the patient data and provides the personalized cancer treatment recommendations and other potential health issues. Google DeepMind, Zebra Medical Vision, Ada Health, and Path AI. So these are some of the case studies and examples presently which are active in the field of healthcare. So which is also providing the better treatment recommendations and patient care. So in conclusion, I would like to say AI holds immense potential to revolutionize the healthcare. So obviously it has benefits are more than the concerns. So that these biases or this can be mitigated. So AI holds an immense potential to revolutionize the healthcare by providing the diagnostics, treatment, and enhancing the patient care. So it is crucial to address the challenges and ethical considerations to ensure that AI is integrated responsibly and even equitably. So I hope this session helped you in understanding artificial intelligence and the advantages and concerns of artificial intelligence in healthcare. I would like to thank each and everyone for your attention. Any questions from the audience side?
Thank you so much, Mr. Saurabh, ma'am. Are you done, ma'am?
Yes, ma'am.
Okay. Thank you so much for sharing with us your valuable cognition on advantages and concerns of artificial intelligence. Ma'am, this topic is critical for all of us to acquaint with as healthcare professionals because of the reliability and genuinity of AI. Since AI cannot replace human emotions and ethics, so it was a wonderful presentation covering all the aspects of all the advantages and concerns. There's always a possibility of many risks involved with the usage of AI. A vigilant and proactive professional would not only ease the work burden but also keep himself or herself aware of the possible and potential concerns to deal with. So, thank you so much, ma'am. Thank you.
Thank you, ma'am. My special thanks to our principal, Dr. Angayar Kanni, ma'am, and all the organizing committees for giving me this opportunity. Thank you. Thank you so much.
Yes, ma'am. Thank you. We will always be giving you such opportunities because we need more and more such presentations and webinar, and more knowledgeable platform to share with. Thank you so much, ma'am.
Hopefully, ma'am. Thank you.
So let us move on with the webinar. Our next presenter for today's international webinar is Dr. Ranjana Sharma, Principal, Shalini Tai Mege, College of Nursing, Maharashtra. And her topic for today's presentation is Future of Artificial Intelligence in Healthcare. I welcome you, ma'am, on behalf of Shri Swami Bhuman College of Nursing, Haridwar. Greetings from our side. Shall we start with the presentation, ma'am?
Yes, 1 minute. Na? Let me share.
Okay, sure, ma'am.
So it is visible, no?
Yeah, attendance has increased, student has discharged. Yeah.
Before we start the presentation, ma'am, please would you wait for some minutes? I would like to introduce Dr. Ranjana Sharma to the audience of today's webinar. Dr. Ranjana Sharma is currently working as principal in Shalini Tai Megi College of Nursing, Maharashtra. Her total professional experience is about 16 years. Dr. Ranjana did her BSc Nursing in the year 2006 from Mother Teresa College of Nursing, from Pandit Ravi Shankar Shukla University, Raipur. She did her post-graduation in year 2010 from SRMM College of Nursing. She did her MPhil in year 2014 from JNMC. She did her fellowship in year 2016 from DMIMS from DMIHERDU. She did her bioethics, law, medicine and ethics of reproductive technologies and genetics in year 2020 from Harvard X from Harvard University. She did her PhD in medical surgical nursing in 2021 from SRMM College of Nursing, Meghe, Wardha from DU. Apart from this, she has 125 publications done till today. She has 13 poster presentations. She has done 9 paper presentations. She has participated as resource person and speaker in around 30 conferences and seminars. She has been a chairperson in 10 organizations. She is an observer for 6 CNEs. She is awarded 3 times as best teacher by SRMM College of Nursing. She is a recognized PG teacher by DMI MS Nagpur. She is a recognized speaker and observer by Maharashtra Nursing Council. She is author for books like Anatomy and Physiology, a textbook for undergraduate nursing students. She is an HOD Medical Surgical Nursing, SRMM College of Nursing. She is a treasurer of Alumni Association of SRMM College of Nursing. She is a supervisor and co-supervisor for PhD in Medical and Surgical Nursing. She has worked as organizer, committee member, observer, and rapporteur for CNE regional, state, national, and international conferences and workshops. She has attended around 140 workshop, conferences, seminars, symposium, CNE. She is secretary of CDP Maharashtra Nursing Council. She is vice dean examination, DMIHER. She is a convener, nursing education unit, SRMM College of Nursing. She is a member of TNAI. She is a member of NSS, and she is principal officiating Shalini Tai Megi College of Nursing, Salod, Hirapur. So that was all about Madam's accolades and awards. We are very privileged to have you, ma'am, with us on today's webinar, and we seek your knowledge and blessings for our students. Thank you so much.
Thank you so much for your
Yes,
introduction, and I am very thankful to the principal madam and other faculty member, those who have invited me for this webinar. Can you tell me my slide is visible?
Yes, ma'am, your slide is visible.
Yeah, it is movable.
Yes, ma'am.
Okay, thank you so much. So I was listening for the previous speakers, and most of the points covered from the previous speakers, but no problem, we will repeat that point. So when we are repeating, and we will understand more. So in this view, we will go through again the future of AI in healthcare. And previous madam was telling about all those things. Some of the points will come again here, but anyway, we will repeat the things. So on the basis of these objectives, what is AI, then AI in healthcare, patient-oriented AI, and the clinician-oriented AI. Then we'll see about the administrative and the operational oriented AI, and AI in nursing care. The most effective part we are going to, because this I was listening, so many people have covered. So this we will focus on more. Okay. So as we know, artificial intelligence is in varied forms and degrees has begun to appear in a wide spectrum of technology from the how come it is so. From the phone we used to communicate to supply chains and bring goods to market. So everybody nowadays using the mobile phones and connecting with the people and with the means getting the things from the market. So that is nothing but that is a AI based, like your Amazon, Flipkart, Mizo, this all working on the basis of the AI. It was previously also, but now we are going to see how it is in healthcare settings. Okay. Then in healthcare, the impact of artificial intelligence through the natural language processing and the machine learning. In that case, okay, we are ordering the things, we are checking what we want, but here what will happen, there will be a process. So that is a natural language processing that machine will do, and there will be a machine learning, and then it will transform the care of the delivery. It's not kind of order, it's a recognition of the things, means what the problem the patient is having and how we can help to the patient with the help of the such as visual perception, and nowadays we can recognize the speech recognition will be languages we years back. I am back 12 years back I am
Hello.
text
Excuse me, ma'am. Ma'am, I think
yes.
there is some network issue in your.
Okay, 1 minute na. Let me check.
Yes, ma'am.
No, it is full. Now it is okay.
Yes, ma'am.
1 minute na. I will connect with the mobile also. Is it clear now?
Yes, ma'am.
Okay, thank you. So what we are seeing about the definition, and the human intelligence only require to make the artificial intelligent. Human brain only utilized for these things and all. Nobody came from the outside and doing this in computer data or recognition of the speech or making the decision. So the human only are doing the things and making the things. So here we can see how the artificial intelligent work, robotic made by the people only, machine learning, computer vision. Then the nowadays speech recognition also will be there. If we are if speech we want to recognize, so like that data is put into that, then we can recognize the speech, whether what kind of the things, whether person is sad or happy, and whether they are lying, that everything, because process is done in the machine like that. Then expert system automation and the natural language processing. Then in healthcare, those tasks can range from the simple to complex and include everything from the answering the people, like to medical record review. We can keep the record, and when we want, we can review the record, and we can match with the other records. Okay. Then a population health trending and the analytics, we can see if anything we want. Now if you want to see the incidence rate or the what is the incidence rate of a particular disease, so immediately you can get prevalence rate, that also we can get the immediately. So it is stored somewhere, that's why we are getting the data. Then therapeutic drug and device design, the molecular drugs and all, and new devices are designed with the artificial intelligence, and it is working in our body itself. Then reading the radiology images, if any radiology image you have, you can put it into the system, then you can get the some information regarding that radiology images also, and the making clinical diagnosis and treatment plan, of course, and even talking with the patients. Okay, so this is also one kind of the AI, what we are doing. I am in Maharashtra and you are from your place, and we can, so how it can incorporating, it is incorporating with the artificial intelligence only, and you can clearly, you can hear me, you can see me. So these are the some examples how it is working, devices are working. And we are just want to see how AI work in a healthcare, but when we are going in a very deep, the one topic is very important, how the decision making support and administrative task it is assisting, then the how medical question answer, so that kind of the data is stored in that, and whatever question means already the person have developed will get the answer, and many images and all that is stored, then with that we are getting the artificial intelligent answer and all. Then for discussion purpose, in the context of the healthcare provider, AI in healthcare may be grouped into the three broad categories, that is a patient oriented AI, how it is benefited for the patient, then how clinician oriented, and the how administrative and the operational oriented AI. I will tell you in a very short, like patient self services is a model that emphasizes choice and convenience by allowing patient to rapidly and easily complete tasks, such as if you are remembering and you ask your parents, and we know when if any appointment we want from the hospital, we have to go there, or then we will get the appointments. And but nowadays, with the help of many systems, we can schedule our appointment, and we can pay the bills, and of course we all are paying the bill through the mobile only, so working as a AI, and filling out and updating forms all at their own convenience, means any updates. Yesterday we are having some other problem, and today some other sinus symptoms, so we can update our forms also, and patients are able to use devices such as phones, tablets, and the laptops to complete this task at a time and the location that fit into their schedule. If nowadays, how patient oriented AI, once more I will tell you, we heard about the telecommunication, we studied in use, so the people are from the rural area, that also can be connected with their doctors. No need to come again. If minor problems are there, they can communicate their sign and symptoms and the things. Then patient self-service benefit for the patient and for the hospital. We'll see here more choice and convenience. More choice and convenience means previously somebody said this hospital, this doctor is good, so we were referring that. But nowadays we can see the which hospital, which doctor, so many choices and convenience, like near to me, and when they are coming, how we can get the appointments. So these are the benefit for the patient: more choice and convenience, faster and easier appointment scheduling, and convenient bill paying, and less time spent filling out or the updating form. I will tell you the one example. of mine. Like I want to take some medicine and some consult with the doctor at Bangalore, but going coming it will more cost. So what I did, I have did the video calling and send the images of where I was having the problem, how much it is feasible and possible, that much only we have to do with this telecommunication and all. And I was getting the medicine and the treatment from the Bangalore doctor. So you can see, and they will send the medications whether it is reached or not, that everything, and they will take a follow up also. So this is one of the example, because reading is okay, but is there any example, anybody experience? So definitely I have experienced that, and I have communicated with that doctor and in the follow up also. And so this is the patient self service benefit comes under. Then for hospital, it reduce the cost, reduce the wait time, and yes, of course, if human is making the air, so this is the artificial intelligence, there may be a chances of fewer errors also, but there will be a easier payment options and increased patient satisfaction. Otherwise, what we have to do, if you are having any problem and somebody suggests that that doctor is there, you have to go and meet that doctor. More than the medicine, we have to pay for the coming, going, and the appointment of the doctor. So this can be the benefit with the AI to the patient. Then AI for the clinician, tools for more effective diagnosis and the treatment. Nowadays, in a very easy way, I will tell you. Nowadays, for the doctors also, there will be applications in the sense. One example I have given here: computer aided detection system. So with this application, they can detect, and it will work in the natural language processing and the machine learning, and with that they can find out the abnormalities, and they can treat the patient, and they can correlate with the clinical information and prognosis. So here one example of the better patient journey, like many of you have owned that watch also, that is wearable, track patient heart rate, glucose level, and the other health indicators over the time starting from here. So our watch is having that new watch, and this kind of the devices also nowadays available, and every day the people are making the new devices with adding some of the things. Previous watch, that what is the name of that watch everybody is using just to see for the calling and for their heart rate and for the how much they have burned the calorie, but now it is added with the glucose level and other health indicators. So this data from the device is synchronized up to the central monitoring system where it is required, and from where, so it is in a central monitoring system, and with this central monitoring system, if any abnormalities, so it will go to the central monitoring system, notify the patient to visit a provider in the sense doctor. Okay, if anybody is having the heart related problem, anybody is having the diabetes mellitus, so they were using this device, and this is connected to their doctor, and when it is required to visit the doctor office, that time they can go and visit, or otherwise if it is normal, then okay. So patient check in at the biometric kiosk at the provider office, means there again they will check with the biometric kiosk, then provider examine the patient and dictated a visit note, and then through the natural language processing and machine learning, it will translate text from the detected note into the confined information in the patient's electronic medical record, whether it is actual problem or there is some default in this smartwatch or that device, that they will identify, and according to that.
Ma'am, 1 second. I seek your pardon, ma'am. Your slides are not moving.
Oh, now also not moving.
Yes. Now it is moving, ma'am.
Now it is moving.
Yes, ma'am. Thank you.
You interrupt me in between, no problem, because there is images, and with the images I am teaching. If they are not able to see the images, then it is difficult to understand for the
Ma'am, I'm
participants.
extremely sorry for the interruption, ma'am.
Now it is okay. No, you can interrupt me. You can interrupt me. I am telling you can
Okay.
interrupt me.
Yes, ma'am. Okay.
Yeah, yeah.
Yes,
Now
ma'am.
it is
Thank you,
moving.
ma'am.
Is it okay? Is it
Yes,
okay?
ma'am.
You can
Yes,
interrupt
ma'am.
me,
It
no
is okay.
problem. Yeah, yeah. So I was
Okay,
telling
ma'am.
about this smartwatch, and like these devices are available nowadays, and the people are making again with the more indicators, and this will help the patient or the person. They can connect directly with the their doctors. Means this with this device, the monitor, there will be a monitor, central monitoring will be there, and this will be give the signal to the provider office, in the sense to the clinician, and when it is required, you have to visit to the clinician if your health parameters are not good, and with the machine learning and the natural language processing, it will come into the text form, dictated notes, and then they will identify actual problem is there and the device is providing the correct data or not, and according to that they can treat to the patient. Okay. Then administrative and the operational oriented AI. So again, in a very short, I will tell you how can it is helping to the administrative. Means now before and all, for the data they are keeping the large amount of the files and all. But nowadays, with this system, with the computer system and other things, they can keep the soft data, and whenever required they can see the previous data, and if it is required to give to the some authorities or the government offices and all, that data also can be easily supplied with the analytical processes, and it can be enabled. Okay. Then AI for more informed and the effective treatment plan design and delivery. Designing the treatment plan in the oncology is another major area in which AI is still means being leveraged, means not fully uh, uh, developed. So they are working on this. With this, what they can do, treatment plan are more often complex and must take into the consideration many factors such as available treatment modalities and the preservation of healthy tissue when targeting cancerous cells. So we all are knowing, when targeting the cancerous cell, it is damaging the healthy tissues also. So the uh, people are working, it should not damage to the other healthy tissues on that they are working. This process can be extremely time consuming and pose significant challenges. So definitely in future it will come uh, in a cancer also. So till here I was telling about the healthcare, what the other people also said. Now we will move to the nursing part, future of AI in nursing. Though topic was AI in healthcare, but we are nurses, we have to know our part also. So it can support the clinical decision support. AI system will assist nursing by providing the real-time evidence-based clinical decision support. How come? How come? I will tell you. This system can analyze the patient data vitals, and we can check AI in the sense that. Monitors, it is working based upon the AIs only. Then the medical history in the system, the medical history is nowadays it is present. Okay. And this can suggest the care plan or the intervention, helping nurses make informed decision more quickly. How come? Can you one or two person answer me? Have you used the chat gpt? Anybody? You are knowing about the chat gpt? Okay. You can text or message also na, in the group. So what happened if you are presenting the data? Is it okay na? It is my slides are moving. I am audible to everybody. I am audible. My slides are moving. Please answer anyone. Okay. So how can, suppose you are vital sign pasting in a AI system. So if it is means abnormal, it can detect and it can give the suggestion of the care plans. What are the intervention you can give? So I asked question: have you used the Chat GPT? Say yes or no. Then madam, please take note. If used, okay. If not used, I will tell you how to use and how we can extract the care plans or the intervention. But in that also, we have to use our brain. Which one we have to apply for that particular patient. So that is in a clinical decision making. Then predictive analytics for the patient outcome. Predictive. It is written up predictive in the sense AI can analyze large amount of the patient data to predict the potential health risk, such as early sign of sepsis, pressure ulcer, hospital admissions. In the sense, you can predict the stay of the hospital. You can predict the whether patient will get the bed sore or not, and whether there is any sign of the sepsis. So this will help the nurses proactively manage patient care and prevent the complications. Then administrative efficacy. AI powered system can streamline administrative tasks such as scheduling, inventory management, and the documentation. This is not only for the staff nurses, those who are working as a administrative post. For them also, they can keep their scheduling. They can manage the inventory. You might have seen when we are going to the medical store nowadays, what they will search how many drugs are, if any drug we want, how many are there, what are the contents. Then that is comes under the inventory management, and immediately they can order if it is in a lacking. And the same for us also, like any article or anything, it is a in inventory, and if it is less in the ward also, if any injection, any medication, that we can use for this, and definitely it will help in a documentation also. Then automating this process will reduce the workload of the nurses and allowing them to more focus on the patient care. Then virtual nursing assistance. Virtual nursing assistance means what? 24/7 you can support to the patient by answering their routine questions. Otherwise, what is happening? The patient is having problems since last 1 week, and they have to visit the hospital, and then they have to ask the question, and by the time the problem will be means complicated like that. So they can ask the questions, monitoring vital sign and offering the medication reminders. This all by the virtual assistant with the help of the artificial intelligence only. And this can enhance the patient engagement, and it is reduce the burden on nursing staff again. Then telehealth and the remote monitoring, as I said, telehealth and remote monitoring for the some chronic condition, they need means every day or in 2 days they cannot visit the hospital. So in that, this telehealth and remote monitoring is very important. They can day to day concern with their doctors or their nurses. Yeah. Yes. Then robotic assistants, as in the previous speaker, she was telling about the robotics, and we are very proud our hospital is having that Da Vinci robot, and it is performing the surgery with the Da Vinci robot, and it will reduce the physical tasks such as managing the supplies and delivering the medication. I will tell my experience. I have seen the robots is having the two arm, one left side, one the right side, and one machine is there, and doctor will sit in one place, and with the sitting position, with the hand they can do the things. It is available in our hospital, and this robotic system can reduce the physical strain on nurses and improve the efficiency of care. Then personalized patient care. Also, artificial intelligence can help develop personalized care plan based on the each patient's unique health profile, medical history, and the genetic information. As I said, no, okay, I have anybody use this Chat GPT. I'm not telling everything you have to take from that, but you can put the health profile and the medical history and the genetic information. You will get what nursing care and how the intervention we can plan for that particular patient. Nursing interventions I am telling about, not the medical intervention. Okay. Then the AI driven education and training. Yeah, definitely. AI can enhance the nursing education by simulating the patient scenario, offering the virtual reality training, and providing the personalized training experience based on the individual performance and the learning needs. Again, nowadays the simulators means dummies are available. That kind of dummies are available. You can perform the many invasive procedure and they will respond, and you can check the vital sign with the virtual training and all. Again, skill lab, simulation skill lab present in our institution, our university, and we have seen this how the education and training is taking place with that simulation labs. Then reduction of errors. We are saying there will be a reduction of errors, but it incorporate in a AI's ability to process vast amount of the data and spot patterns. The risk of human error in medication administration, patient care, and the charting can be reduced, because once you have entered something for one patient, so definitely there will be a line. You cannot enter the same thing for that patient. So with this way, we can remove the medication error or administration or the patient care. You have given the care, then and there you have entered, then it will be a beneficial. So AI can serve as a safety net for the critical task also. Then this is a little difficult. Emotional and the social support system. AI system that analyzes speech and behavior may assist nurses by detecting the emotional distress or depression in the patient. Yes, previously it was not there, but what they have done with the AI, the human being, what they have done, intelligence of the human only in this also, they have recorded the many kind of the speeches in the that system, and they can detect whether the person is emotionally distressed or in a depression. So again, how they have entered that data, how they have entered that speech, it is depend upon that, and promptly timely mental health intervention they can provide to the patient. This tool can help address both physical and the emotional aspects of the patient care. So this is the last slide. While AI has great potential, the integration of these technologies will need careful regulation, and it requires the training and oversight to ensure they complement the nursing workforce without replacing the essential human elements. Nobody can replace the care, empathy, and the compassion. Okay, so though the AI is helpful, but there will be a human elements of care, empathy, and compassion is required for the patient care or in a healthcare. Previously, a speaker was telling about the benefits and all. So definitely benefit will be there, but nobody can replace the empathy and compassion. So this was about the AI and healthcare. So in short summary, it enhanced the patient care definitely, offering the accurate information. It reduced the care cost, and AI in a drug discovery nowadays, and data can improve the diagnosis. Okay, so this all about my presentation. If anybody is having any doubt, they can ask me. And I asked one question: have you know how to use the chat GPT? If you are using, that is good. If you are not using, I can say in a very short. Thank you so much from my side.
Much, ma'am, for your valuable knowledge and your presentation on the topic of AI.
Not audible.
Ma'am, and your knowledge mean a lot to us, ma'am. I say thank you once again, and we hope and look forward to have more such endeavors, knowledgeable endeavors, in fact, in the near future, ma'am. Thank you so much, ma'am. for participation.
Thank you.
Take care. So, let us move on with the webinar. We have our next presenter, Dr. Nageshwar. He is an assistant professor, Faculty of Applied Medical Sciences, Al Baha University, Ministry of Higher Education, Kingdom of Saudi Arabia. Let me introduce him to the audience. Dr. Nageshwar has done his basic BSc Nursing from Government College of Nursing, Bangalore, from Rajiv Gandhi University of Health Sciences. He did his MSc Nursing in Psychiatric Nursing from Father Muller College of Nursing, Bangalore, from Rajiv Gandhi University of Health Sciences. He did his PhD Nursing from Manipal College of Nursing, Manipal, Udupi, Karnataka, Manipal University. Apart from this, Sir has published 23 papers, attended 16 conferences and workshops. He did 5 presentations, and he has around more than 14 years of work and teaching experience. Apart from this, he has done short-term courses, certified in pain management course from Joshi Institute of Pain Management, Hyderabad. He has certified himself in biostatistics and research methodology from Manipal University, Manipal in 2013. He has learned computer basics course from Bangalore during graduation sponsored by Government College of Nursing, Bangalore. His interested academic and research areas are psychiatric nursing, personality and dissociative disorders, research-based education, bridging gap in theory and practice, testing educational interventions to develop interest in students, nursing administration and curriculum development, research and publications. Apart from this, the co-curricular activities that he has participated in Pulse Polio programs 2 times. He has participated in various workshops and conferences at regional, national and international levels. He has presented posters during observation of days related health and nursing, Nurses Day, Women's Day, Alzheimer's Day, TB Day. He has participated in health talks, TV and radio programs in Bangalore. He has been awarded 3rd prize in regional level Republic Day parade at GBVM School, Chitradurga in 2010. Apart from this, he is ACLS and BLS trainer. He is a PG coordinator. He is a faculty DEF program coordinator. He is an academic coordinator, HOD in charge, Department of Psychiatric Nursing, statistical consultant for Nursing and Dental College. He is a narrative review expert, peer reviewer for articles, and he has expertise in using SPSS data analysis. So that is a commendable biodata that we have, and we are privileged to have you, sir, today. Thank you very much for joining us on this international webinar. Thank you so much, sir.
Thank you, Nidhi. Thank you, Dr. Nidhi. Am I audible to all?
Yes, sir, you're audible.
Okay, thank you so much for your wonderful narration on me, and I am privileged to be here.
Sorry that I have left out so much on your CV because it was really commendable and it was very long. So much of acknowledgement award.
No worries. I don't mind all those things, Just my name is enough.
Okay, sir.
Never mind. I don't mind. Leave it. All those things are like a blink of an eye, We finished all those things. We should not take over those things to the further, because further what we have to do, we have to see. Whatever we have done is like a blink of an eye. It's finished. No, you can't, carry all those things. So forget it.
And, the people who are, who have gained so much in life, they are so humble. And it has been pleasure talking to Dr. Ranjana, Dr. Jaya, and you also, sir. And all of you are very, very humble. So I'm feeling very privileged to be talking to you people and gaining so much of knowledge and interaction from you people. So that was very generous of you that you know, forgave me for not mentioning all of your awards and achievements. Because some of the
No
people, they,
issue, Dr. Nidhi. We are all family. We are all one family, nursing, right?
that's so
So,
wonderful, sir.
and you are giving me a privilege to talk to India from a different country. That's a privilege for me. It's not your
Yes,
privilege. Like it's my privilege. Like I am getting an opportunity to speak my students out there in
thank,
India. I
thank you,
hope
sir.
this interaction will be more of discussion. Probably
Okay.
the people who spoke already would have spoke much about AI and ChatGPT, all those things. I don't want to dwell much into those things. But let me, ask few questions because already we are running short of time. I just don't want to drag too many things.
Sure,
Uh,
sir.
so, shall I take over, Dr. Niti?
Yes, sir. Yes, sir. You're free to take over.
Yeah, thank you so much. Thank you so much. Yes, it's me, Nageshwar Venkatesh Reddy. I am basically from Karnataka. So I hail from a small village. My parents are still farmers. I have not done much achievements in my life. Just did some qualifications, and I'm here working. Just forget about whatever Dr. Nidhi have explained. I don't, take consider all those things are my credentials. It's all because of my parents, my teachers who are all on the way, who have helped me to reach this level. And today also, I am joining here because of Miss Sonam. It's my privilege that she has, taken my name for this webinar. Without taking much of our time, let us discuss few things, what you have discussed so far with others. Um, I just wanted to know from few of you, like what is AI? What do you mean by AI? Can you hear me, right? You hear me, right?
See, I request all of the audience to be participative. What sir is asking, you have to answer
Yeah.
because I want a discussion session. So all the audience, students and
You,
teachers,
you can
I
unmute
request,
yourself and you can answer, yes.
yes. So you can answer by unmuting yourself. Sir is asking what is AI. Students and teachers, please be
Is there
interactive.
anyone out there? Yes.
MSc students, Anirudh.
Hello.
Yes.
Yeah.
Good
Mr.
afternoon. Good
Anirudh.
afternoon, sir. Good afternoon, sir.
Yeah.
Sir,
Yeah, go ahead. Go ahead. What is AI? What is AI?
sir, artificial intelligence. We can say that with intelligence in today's life, we can help ourselves with the new technology, with the new devices, and with the new methods by which we can make our daily life easy. But with that
Perfect.
also, there is a sense of responsibility for every one of us, so that we should use it properly.
Perfect. Thank you, Anirudh. Thank you very much.
Thank you, sir.
Now, artificial intelligence is anything which makes your life convenient. Nitin. Yeah, okay. I think he unmuted it. He muted it. So anything which makes your life easy nowadays, like everybody used to do Google search. What is the difference between Google search and artificial intelligence? Is there anyone who can answer this? See, we have a Google also, and we have an artificial intelligence. What does it makes a difference?
Sir, sir, can I speak, sir?
Yeah, please go ahead, Anirudh.
Sir, if we search for just an example, if I am searching regarding MSc nursing, sir, it will show the different type of courses, the syllabus, and different types of field, and like child health nursing, medical health nursing. And if I am searching in AI, MSc nursing in child health, it will be particular and specific. it will give us the specific search what we are searching.
Okay. So the word specific in the sense, like, yeah, okay, I agree with you, Anirudh, no issue. But I would like to add a little more here. Thank you very much. I would like
Yes.
to add a little more here. See, like if you have this kind of interaction, we will understand what is your, awareness. Now, artificial intelligence is the consolidated information of Google search. Consolidated, like whatever is available over the Google search, like if you have all the pages, they will consolidate it. So the artificial intelligence, the machine has been, coded in such a way that they will capture the information of all the websites. They take the content from all the websites, and they will write their own language, and they will give you easily, okay, this is what you are expecting for, right? Yeah, fine. So now I will just wanted to show you one search where we can do artificial intelligence. We can use artificial intelligence where there is one. I mean, there are so many billions of sites are available for artificial intelligence. It's need not like you need to have only one or two. There are billions of available. But according to me, you can search, you can log in, you can have any one website or any one like Meta AI, whatever. You can use that. I hope many of you are already aware of this kind of examples. Let me share my screen. I will show you what did I search. Can you see my screen? Anyone? Can you answer? You see my screen now?
Yes, sir.
Yes, sir, we can see.
Yeah. See, my topic is like, how do you use research? How do you use AI in research? Now, there is one review of literature. I just wanted to know how much ghee is good for a day. I wanted to find a researches which is happening. How much ghee is good for a day? Now you see there is this is one AI based generated kind of answer. Now this is taking from 10 sources. You see here. Now if you have to go to these 10 sources, you have to go and read one by one. But the consolidated information of these 10 sources, which are very genuine, it is saying the consumption of ghee, a type of clarified butter commonly used in Indian cooking, has been subject of various studies examining its health benefits. Now, I have asked what 1 to 2 tablespoons, it means 15 to 30 grams per day is good enough. And there is a references also. Now, let's say I will tell you what's the difference between this one and how we used to do it before. Earlier, what we used to do, we used to go take this article, right, and read it and write it, again take another article, again read it, again write it, then finally we are going to conclude and write these sentences, and we write the references. But today it is a handy, right? Probably earlier it used to take some days or some months, but now today it is within few seconds you are going to get this. Understood? Do you have any doubts here? Anyone? You have any doubts here?
No, sir. You can carry on, sir.
Clear. Thank you. Now further, what, like, if AI can give everything, right? If AI is giving, right? Now what is our role? Like anybody, a common man who is going on the road can search and can get the information. What is our role? Anyone can answer. What is our role here? That's what actually my topic is. What is our role? See, there is nothing like right or wrong answer here. Anybody can answer anything. Anybody can answer anything, you know, right? Never mind answering. Please do answer something. Or you can have it in a chat box also.
See, the audience, please respond. We have so
Hello.
many people.
Yeah, Anirudh, go ahead.
Sir, actually, I am not clear about the question. You are asking about our specific job, or
Yes, as a nurse,
yes, sir.
as a nurse,
Okay.
as a nurse, what is your role
Sir,
when AI can do everything?
sir, AI cannot give the nursing care to a patient. For providing a nursing care to a patient, a person should be needed.
Absolutely, I agree with that. I'm not talking about patient care. Probably,
Okay.
Probably already those people who spoke, they have already spoke about patient care. I'm talking about
Yes.
research. Talking about research, right? Now,
Okay, sir.
research-wise, AI can do Sonam. Can you unmute it? Yeah, I'm talking in terms of research, right? Now,
Okay,
research,
sir.
when I am doing everything and I'm getting everything online, now why nurse?
Sir, when we go for data validation, or when we are going for when we are validating our data, reliability and validity of data. So when we are doing it, should not be biased.
Yeah, 100% right. Anirudh, you would have been the
Yes, sir.
resource person for this webinar.
Sorry, sir.
No, you could have been, really. I'm not just exaggerating, but you could have been. Because see, today's trend is like everybody knows everything about technology. There is no point in like we involving here. Now, of course, validation and reliability is the exactly 100% right word to be used. Where earlier in Google search, we don't know how to validate it. Now, AIs are validating it very easily.
Yes, sir.
Right?
Yes,
Good.
sir.
Very good. Thank you. Thank
Yes,
you, Anil.
thank you, sir.
So, validation is one aspect where you are really, using this AI for your benefit of the researchers. And moreover, see, the available information it will tell you. The AI will tell you the available information on the website.
On the data.
Yes, but there are plenty of information. There are quite a lot of expertise is outside the web world also. Now you think only whatever is there in the web itself is the end. It is not so. So there are a lot of information which is available outside the web world. Let's say you cannot get the patient information of the hospital in the website, that you could do only by going to the hospital, which is private, and you need a lot of permissions, lot of convenient ways of getting administrative logistics, You have to convince the people to get the data, which is not possible through AI. You might have seen the movie Robot, which has come maybe 15 years before, where in that movie there is one scene they have demonstrated for the purpose of showing that artificial intelligence won't have emotions. Now, this is the only aspect which will differentiate you from the artificial intelligence and which is prime for the nursing. Be it a patient care, be it a talking to any individual human being, be it you are talking to a teacher, be it you are ready to convince some administration, you need emotions. Although I am from Department of Psychiatric Nursing, I give more importance for emotions. Why? Because if you can't do anything through the knowledge, it is the only way to do is using your emotions. If you go back and check the history, if you have a knowledge, you would have not survived in this world. If you have emotions at a particular point of time, and what type of emotions is needed, if you have that, you are definitely going to go forward. And that's how we have to learn from the artificial intelligence, because it is very fast, it is very accurate, and you can take a decisions within minutes. But unfortunately, we have emotions. Artificial intelligence don't have emotions. Now, if the artificial intelligence comes with emotions, I am sure definitely you and me are not going to live in this world for next 1 year, and everywhere there will be only artificial intelligences. Understood? Am I clear about the concept?
Yes, sir.
Yeah. So why I'm telling this, because there was a record that there was a social media experiment which has happened maybe a few years before. They have I don't want to mention, this is the public platform who has done. There was a bot. There was an artificial intelligence they have developed. Two artificial intelligences they were developed to manage the whole social media platform. Unfortunately, what has happened? After a few days, these two artificial intelligence, they started to speak themselves in their own language without making anybody to understand it. Finally, what will happen if that is the case? Just imagine. Just imagine what will happen if that is the case. You understand what I'm saying?
Sir, that can be dangerous.
Very dangerous. If I and you are speaking with the language which nobody in the world can understand, you can do anything to the world. And that is that is artificial intelligence. So never mind, be it whatever kind of artificial intelligence we get in this whole world, the emotions which we carry is carrying a more importance. So it is just a transformational technology which helps all the healthcare providers, which helps in building the concepts, and of course it helps in developing the knowledge, which is very helpful for designing very good care to the patient. Right? I'll give you one more example. 30 years before, our thoughts per day were very less. You mean we used to think very limited number of thoughts, so you are not very stressful. You used to think even at the end of the day, your mind used to think. But today, every 30 seconds, every 1 minute, there are so many thoughts you think because of the social media. You use a lot of reels. You change your emotions every 30 seconds, every 1 minute. And this change of emotions is causing you very, very tired, very exhausted at the end of the day. So you cannot do the work. You cannot use your brain at the end of the day. So it means we are going very fast. The time is going very fast. I mean, 30 years before, what you used to do in 5 years, today we are doing it in 1 day. At the same time, our age is also going very fast, right? Like earlier, your age might be 50 years. You used to look like 40 years. But now your age is 40 years. You used to look like 50 or 60 years. So because of this, transition, because of this change, we are very fast. Of course, in a day, you are a human being. Because of you are having an emotions, your thoughts are more. In a day, half of the day, after half of the day, you get your, emotions get exhausted at the end of the day, and finally you will stop thinking, and you get carry on with your whatever the thoughts coming in your way after some point of time. Because of this, we invented artificial intelligence, which helps us to boost our thinking. I hope I have addressed the topic. If any of you have any doubts in 5 minutes, you can ask me. I am ready to clarify if I know it. Anyone?
Yes, sir. I have a question.
Yeah, Dr. Nidhi, go ahead.
Sir, as you said that there was an evidence-based practice on how AI developed their own language.
Yeah.
And we are growing at a very fast pace, and as you are saying that every person today wants to have technology at hand.
Yes.
And robotics are an in thing, very happening.
Yes.
So what do we expect? I mean, as a professional, what do you think is the future of AI in healthcare? Will it really work, or we will get such experiences that you shared with us, like AI had their own thing done?
No,
So-
you are right. I understand your apprehension. I will answer you now. See, anything which damages human race, definitely, we are all selfish people, human beings are very selfish. And I'm just openly saying to you, anything which damages us, we don't want to let it survive. Like we kill all the animals, we spoil the environment, we want it to survive. This is how we are doing, right? Now, even if there is an artificial intelligence, what we do, if there is something like this will come tomorrow, like both are speaking on their own, we will kill that also, because this experiment has happened last 10 years before. They have killed them. I mean, they have completely destroyed them, because tomorrow what is going to happen, they were not knowing. As a human being, we don't know what they will speak to each other. That's why they are completely destroyed it. Now, if we are going to that extent with this concept also, those who have developed and all over the world, the so-called intellectuals will come to a picture and they will destroy it. I am sure about this. And you know about, like, now you can generate, you can make one more Dr. Nidhi, one more Dr. Nagesh, one more Mr. Anirudh. This invention has happened 30 years before. You can have one more Sachin Tendulkar, you can have one more Warren Buffett, you can have one more celebrity. Why can't we do this? Because all over the world, everybody came to a conclusion that we should not go against the nature. So they stopped it. Otherwise, all over the world, only there will be Sachin Tendulkars. There will not be anyone. So don't worry. If anything is going to happen, we are going to stop that. Everybody will stop that.
So that means we want to have it in a controlled way.
Of course, everything. It is not only AI. Everything you should have in a controlled way.
Thank you, sir, for the answer. I just have one more question, sir, if you don't mind.
Yeah, please go ahead.
Sir, do you think that someday we would be able to develop human emotions in AI? Like there is a called Robot, South movie. You might have seen.
I saw. You know, see, Dr. Nidhi, this is a hypothetical question, because 100 or 200 years before, nobody knows we used to fly in the air. If anybody asks the question, do we fly? No, you can say, how can we fly? Is it not? It is not possible. How can a human being fly? But today we are flying, right, in the aeroplanes, in the flights. So I'm not sure. Maybe or may not be. Even if it is, we may not let it survive for a longer period of time, because emotions are the only way you are surviving. You and me are surviving today.
Yes, sir.
If you give that emotions also to these AI and robots, definitely there is no point of you and me in this world, right?
Yes, sir.
So I don't think anybody will make an attempt to at least make sure this is possible. But if at all, if they do also, they may not come out. I mean, they will not give the permission to, handle all those things. Otherwise, no human race will, take its own way. But mythologically or spiritually speaking, it is better human race should end so that this earth will survive. In that case, we don't know. Like how, atomic bombs came to an existence. There is a pros, there is a cons. There are some people who are having it. We don't know who are having it, who don't having it. But if they use, earth is going to destroy it. In the same way, this is also another technological disaster. That's it.
Thank you, sir.
Welcome.
Any other questions from the audience? Questions from the audience?
I don't think they have any questions. I hope I have answered. I have done justification for your topic, although there is a limited time. I just have some other commitments to go ahead. That's why I could not give much time for you.
Not a problem, sir. It was a wonderful interactive session with Dr. Nageshwar about the role of AI in nursing research. Let me take a moment to thank him. Just one minute more, sir. Got an idea that AI cannot replace human emotions. You also shared evidence-based practice on how AI can be dangerous and what can be future predictions regarding AI. We can just hope so that we, get to have the best of it and in a controlled way, since we are going at a very fast pace. So it was really wonderful interaction with you, sir. And I thank you on behalf of Shri Swami Bhuman College of Nursing, Haridwar. And I wish and I look forward that we have more interactive sessions with you, sir, in the near future, in more webinars, in more seminars on various topics in healthcare. Thank you so much, sir.
Thank you very much, Dr. Nidhi. Thank you very much, all of you and your college, your management, for giving me an opportunity. Hope we will meet soon again. Thank you so much.
Good afternoon, sir.
Okay, so that was all about the international webinar. At last, I would like to pay the vote of thanks to Dr. Jaya Pranoy, Mrs. Saurabha, Dr. Anjana Sharma, and Dr. Nageshwar, all the participants, speakers. I thank the college management for allowing us to hold this event. I thank all the students and scholars who attended and participated this webinar with so much patience. Thank you very much, all of you.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am.
See, you are allowed to leave.